All right, so good afternoon. For those of you who are new to my platform, I'm Dr. Earl Turner. I'm a psychologist and founder and executive director of Therapy for Black Kids. And I wanted to welcome you all to our fireside chat today that's hosted by Therapy for Black Kids. And we are discussing children's mental health. If you have questions or comments, feel free to use the chat box today. We will be engaging with that, and also we'll save some extra time at the end of the conversation as well for you to chat with us. So before we introduce our special guest, I wanted to just share a little bit of information about why I wanted to have this conversation. So as many of you know, a few months ago, the Surgeon General released a report on children's mental health, and it noted that difficulties have significantly increased among youth since the start of the pandemic. So prior to the pandemic, about 1 in 5 kids had some diagnosable mental health condition. That's increased to about 40% according to that data, and now notes about 1 in 3 students experience some level of emotional or behavioral difficulty that may warrant treatment. And so I think it's a really important time for us to have this conversation, to talk about that, and also understand what are the ways that we can maybe help address this in our own kids and in our families. So I'm excited to have a special guest join today, Dr. Searcy-Pate, who is a pediatric psychologist in Chicago. She's also the author of the new children's book, Olivia Takes a Mental Health Day. So thank you for joining us today.
Thank you so much for being here. I think I've been waiting for this event for over a month, and I thank the attendants for being here.
Perfect. So the focus of the conversation today is the check-in, and I'm hoping that this will provide some tips for parents and ways to recognize early warning signs, but also ways to promote positive mental health. But before we sort of get into that conversation, I wanted to start with you, Dr. Searcy-Pate, and maybe you can tell the audience a little bit about your work and your clinical practice.
Right. So I've been practicing as a clinician. So I identify as a clinical psychologist by training, with a specialty in child and pediatric psychology. So what that means is I treat general childhood concerns such as anxiety, depression, ADHD, adjustment to divorce or grief. But I also have a specialization in treating children with chronic medical conditions such as sickle cell disease, diabetes, and so on. And so I serve a role in 3 parts. So 3 different jobs that I do. I typically consult with medical providers and parents across the nation. I'm a PAC member, so I typically see parents and consult with clinicians out of the state of Illinois, although I'm licensed here. I also conduct testing for children who have concerns such as ADHD, learning difficulties, autism, and etc. And I also provide one-on-one therapy as well as family therapy to individuals who need those services as well. So that's a little bit about me.
Great, thank you so much. So a lot of things that can really be helpful for the conversation today. One of the things that I really wanted to talk about it and why I wanted to have you on was because I know you wrote this book that's geared towards kids. And so I was curious about maybe you can share a little bit about your inspiration or what, motivated you, to write that book now.
Wow. So I could go 2 hours talking about this because this is a passion of mine. And for those of you who are on, how it really started is I took a sabbatical. And so I took some time off last year in the midst of the COVID-19 pandemic. And it was a reshift, right? So I took about 2 weeks off and I said, I'm not seeing any patients. I'm not teaching during this time. I'm really focused on this children's book. I already had the narrative written. And then on TV around June and July, I saw where Simone Biles took a step back from the Olympics as she was competing. And that really pivoted the narrative for Olivia Takes a Mental Health Day, which is actually in the rear over here. which is about an African American girl. She's 9 years old. She is the forefront of the book, taking a mental health day to take a step back to recover from what's going on, but also the why of the narrative. And I think you mentioned Dr. Turner was the US Surgeon General. So during that time, I was still writing, editing, as well as getting an illustrator. And I saw the US Surgeon General report, and specifically when it talked about BIPOC communities, and more specifically, African American children, and rates really increased when we talked about death, loss, suicide rates, depression, anxiety in the midst of the pandemic, right? But we also know there are a lot of factors. So that was another why. And also writing the book, I saw that when we thought about children's mental health books or children's books in general, really 4% of books had a BIPOC character. And let's kind of narrow down that number, right? A Black child as a forefront, right? So that was more of my why to writing this book. Now, when we get to the book, it's about a 9-year-old girl named Olivia, again, who takes a mental health day, but she's going through a number of stressors or adverse childhood experiences in the book. And with the help of her friends, her caregivers, as well as medical providers, she realizes that, hey, I'm brave, but being brave means to talk about my feelings, to say and verbalize when I need support and help, and to recover and take a step back and have a mental health day. So that's a sum. Yeah.
Yeah, thank you for sharing that. It's really important, I think, to let kids know that they can talk about these things. And I know for a long time in the Black community, we have not wanted to have conversations around mental health. And I think, as people that follow the Therapy for Black Kids on social media know that there's a lot of stigma. There's sometimes we make these judgments about kids and what their behaviors mean. And so I think it's really important and helpful to really acknowledge that we all have mental health, and that's the different, like the flip side of the coin in terms of like mental diagnosis or mental illness, but that we want to make sure that we encourage kids to talk about those feelings, because we know, especially in, I think, Black boys, that those feelings are not always normalized to talk about. So I think it's necessary that we do let them know that it is
Yeah.
okay to experience difficulties, stress, worries, whatever it is, but also to talk about it and also seek that help and support. And so, as we've been talking about the Children's Mental Health Report, we know kids are struggling, especially since the pandemic. And so I'm wondering, given your own work that you've done on this topic, helping families, what are some of the like ways that kids sometimes show stress? Because I think sometimes parents don't know, like, is this something that's typical for my child, or is this something that I need to be concerned about?
Right. So when we think, that's a great question, and a lot of parents and clinicians ask me frequently, and I'm sure about you, Dr. Turner, and the attendees. Oftentimes, I do tell caregivers in the context of COVID, death, loss, tragedy, ways in which children, adolescents, teens, youth, whatever you would call it, show these signs is that typically there could be an increase, right, in irritability, right, sadness, isolation. If there's a change in overall level of functioning, right, so children cannot concentrate, there are sleep concerns, there have been a regression of skills in anything, there's clinginess, or a child constantly says, I don't feel safe or don't want to be without caregivers. These are some early warning signs for caregivers to say, hey, perhaps I need to query, right, or talk to Jasmin or Oliver about what they may be experiencing, but also check in, right? And I also tell caregivers is that if it's 2 or 3 weeks and these signs are continuing, that's a signal to reach out for support if parents are not able to talk to the children themselves to kind of start these conversations. So,
Yeah, that's really helpful. So I think you sort of touched on a lot of different things that are really important that sometimes can be just sort of typical stressors. I think like, the sleeping problems or the being irritable, like we all, like if we have a bad day or we may be stressed out, that we may show some of those signs, but that doesn't mean necessarily that we sort of have a diagnosis, or that we
Right,
necessarily need to maybe
right,
go to therapy, for
right.
example. And so I'm curious about, given, I know you mentioned the time frame, a couple of weeks. I'm wondering, like, are there other things that parents like need to be particularly like pay attention to, that lets them
Yeah,
like, okay, these are like stresses that my kids are experiencing. I should like recognize, okay, it's a pandemic, they're struggling, whatever. So they should have these, stressors
yeah.
or these symptoms or emotions. But when does that sort of cross over to say, okay, this is something I definitely need to take them to go get some help or talk to a professional?
Yeah, so that's a great question. And I don't know in your experience, Dr. Turner, since the pandemic, worry, sleep, and safety concerns have increased, right? So I've had youth who have verbalized, right, to their parents before they've reached out. I've thought about not wanting to be here anymore, right? Or things are just really, really bad that I'm thinking about harming myself, right? Or jumping from the lake, right? Those concerns have increased. And what I often say to parents is that when we start hearing things from children and youth about not wanting to be here, or anything revolving safety, that's a definite signal to say, hey, I need to reach out to someone. This is something that may be beyond my expertise, and I may need to reach out for support to consult. Even if you're consulting versus starting or initiating therapy for your child, I think that's where parents need to really capture that, because what happens is if we let it continue to linger on top of the other stressors or signs, right? Plus the safety concerns, sometimes it can build up to a big circle, right? And by that time, therapy will be beneficial, but sometimes with youth, it may take a higher level of care, to be honest, if it worsens in the context of that. So I would really say those safety concerns are the biggest key points for youth.
Mhm. Yeah, thank you for sharing that. I was actually just recently talking about that, because I think when kids talk about, not wanting to be here, or something like that, that's a scary topic for many parents,
Yeah,
and really don't know, like, should I ask kids about that in terms of wanting to like hurt themselves, or what's the language should I, use, especially if it's a young kid. And one thing that I've talked a lot about over the last couple of years is that we continue to see at a much younger age that children are expressing suicidal thinking. I think some of the more recent cases in terms of death by suicide, like kids as young as 8 or 9. And so I think,
yes,
it's really important that you do have those conversations, and that it's okay if you ask, do they want to do something like, hurt themselves, and if they've thought about it. And if they do, to make sure
right.
that you do, seek out some help in those cases, to work with a professional, or, even though it can be scary to go to the emergency room, that can be a resource short term, at least to sort of get some
Yeah,
help as well.
absolutely. I'm glad you close that feedback loop, because I often tell parents if that does come up, the question shouldn't be why, right? To reframe
Mm,
the language of why, Jasmine, why would you want to do that, right? We're guilt tripping a child, right? Really, the number one thing is I have a tips model, right? Talking, right? Definitely providing a safe space for the child so that they can talk about those emotions, and then you proceed from there on the next steps. But I think, to your point, Dr. Turner, if a child is discussing or verbalizing or exhibiting any safety concerns, parents should provide that safe space so they're able to talk about it in that. And because parents, that's what we want when you think about it
mhm.
overall. And then we can get them to the support that they need, whether that's to a therapist like us or to a higher level of care. So,
Absolutely. Yeah, so as we continue the conversation, definitely post any questions that you may have in the chat. If you want to send a private question because of privacy reasons, etc., feel free to message me directly as well, and then I can bring the question up for us to discuss as well. One thing that I wanted to talk about, I try to focus a lot on preventative mental health,
yeah,
and so trying to figure out what can we do to help give kids the tools and skills so that they can be able to try to manage things before they sort of escalate to this point where they feel like they are crumbling or struggling too much. And so I'm wondering, what are some of the suggestions or thoughts that you have for parents about how they can help promote positive mental health and adjustment in their kids?
Yeah, and it will vary. That's a great question, Dr. Turner. I have a tips model that I always leave with my parents when they come see me. The T, so if we think about tips, TIPS, the T is really providing that space, right? Safe space to talk about your emotions openly. So every day you're spending time with your child in some way, right? That's the assumption in providing a space to talk about, in general, about emotions, right? Because we want children and youth to have basic emotional expression. And to be honest, sometimes when I work, in my experience, when I work with children and youth, sometimes I find children as old as 13 and 14 may not have that language to say, I'm sad or I'm feeling frustrated, right? And I think parents with a T should talk about their feelings and model in that way how to manage uncomfortable or difficult emotions, right? The I is also identifying your own emotions, parents, and modeling that for your youth, right? So if you're upset and you throw something along the wall or react in a different way, children see, and what they see sometimes they become, right? So if we're handling difficult emotions in a certain way and we're identifying them, they're seeing that and we are modeling that for them, right? The P is providing that safe space, right? So when our youth are coming to you and saying, hey, my day it's really been tough today, right? Or on a scale from 1 to 10, my day was at 8, right? Providing that safe space and being non-judgmental would really greatly benefit youth in that aspect and not reacting and just listening or really asking your youth, what is it that you want me to do in this moment? Do you want mommy or dad to listen or do you want me to give you advice, right? So really just listening in that moment. And then the S in that tips model is structure. So providing safety and structure, which is that consistency for our youth so that they can feel like they're in a patient, non-judgmental and safe space where they can open up, communicate and talk about their emotions and learn from you in a really good way when you think about that, right? And I would leave to parents who are on this call or this webinar to really model. Think about model every action that you do or have in front of your child. Think about how or what am I teaching subconsciously or unconsciously through my actions today, right? Or when I'm talking about my emotions or hearing my child talk about their emotions, how am I modeling positive things for them? So that's what I would leave.
Perfect. I love that. I've never used the tips sort of
Yeah.
approach, but I definitely, as a child psychologist, have talked about the importance of like modeling and that kids are observing. So even though you may not be verbalizing things to them, like they witness and they see how you behave and respond in situations. And so that also teaches them how to navigate life and deal with situations. So I think, one thing that I've had, with some parents that I've worked with in the past is parents are afraid or they get nervous about like, do I always have to like maintain things for myself? Like if I'm having a bad day and stressed out, do I have to like, okay, act like, okay, it's going well. And so I say, to parents, like sort of piggyback them off of what you mentioned, that life is not perfect. And so you are going to have those days where you struggle and that's okay. And if you want to go back and have conversations with your kids about, hey, mom or dad, we're stressed out, we made a mistake or whatever.
Mhm,
Now this is what we maybe could have done differently in that situation. That's
mhm.
also helpful and teaches kids how to problem solve. And so I think those pieces are important too, to let kids know that even if I am angry and I yell when I know that's probably not the most helpful thing to do at that moment, that I can say, you know what, earlier today or yesterday, I yelled and I should not have
Yeah.
done that. This is maybe how I can maybe talk about it or tell you why I was frustrated or
Yeah.
angry. Those types of things are really also important to do with kids as well.
which is self-reflection and that modeling aspect, right? Yeah, that's what you're doing. And I actually like that. I was going to add that children as young as 2, this is, I don't know if you get this question, Dr. Turner. Parents often ask me, because I work with children as young as 3, well, how old should they be where we start talking about
Mm,
emotions and feelings? And what we know with research, children as young as 2 know how to identify emotions. They know if we have a boo-boo or say I hurt, right? So they are really able to identify those emotions. And so we should start thinking as young as 2, as young as 1, to start modeling and talking, right? And showing different emotions and feelings so that as they age, they could start learning, right? And taking in that information through that modeling and us verbalizing that. So I wanted to add that as well to yours.
absolutely. Thank you for that. And I appreciate the question in the chat. I did see it, and we
Yeah.
will get to it in a second. So thank you for bringing that up. As we sort of close, and I know I want to be respectful of people's times before we open it up for some more questions as well. Any sort of general resources or maybe 1 or 2 things that you think might be helpful for parents to help them navigate, some of this in terms of either finding ways to identify, if their kid is struggling and may benefit from therapy, or other suggestions about resources in terms of emotional wellness.
Right. So I do think, before I get to the resources, parents, if you're on here, and then obviously clinicians or educators, you are equipped, right, to talk to your children about things that they're going through. You're well equipped. However, some parents and caregivers, they manage or have difficulty managing their own emotions due to what they may be experiencing. And if so, that's your number one signal to say, hey, maybe I should seek out consulting with a Dr. Turner or Dr. Searcy-Pate just one time to see if I need to just consult or maybe initiate services for my child. So if you're having these questions, you can reach out through Psychology Today. You have Therapy for Black Kids, which is with Dr. Turner, his foundation, where it has those resources. And I actually have caregivers from all over who reach out and say, hey, and this is via email or Psychology Today, to say, hey, can I consult with you just once, just to see if I'm doing everything that I need to do, or most of the things that I need to do, because no parent is perfect, to make sure that Jasmin is well equipped from an emotional well-being standpoint, right? So that's the first suggestion that I would have. Regarding resources, let's say if you don't, if you're limited financially or underinsured, that's the term that I use, what you can do is there are resources. So the Centers for Disease Control, right? You have Child Mind Institute, right? And I sent a lot of resources that Dr. Turner should be able to post. If you have questions, there are resources specifically that I put geared to BIPOC communities, Black youth, right, as well as general resources that if you're a caregiver, you can reach out to find out more information about what should I be looking for? What are the signs, right? What language should I be looking for in my child? We just had a adjustment in our family, or death and grief. Listed on those resources, you can go and refer to them. You can find out information about how to reach out for further support if needed, as well as if you're underinsured and you're looking for financial support so that you can get your youth or child into therapy. And likewise, if you're a clinician, you're also able to link families who reach out to you. If you are not accepting clients, you can refer them to those resources as well. So,
Absolutely. Thank you for that. And I will share those
yeah.
resources to everyone that registered. I will email all of those out, so you will have access to all of that. I also posted the link, so to get to Therapy for Black Kids, we do have a list of resources or potential therapy providers on the website, and so you can look at that. And we also try to provide some technical assistance. So if you get overwhelmed by information, you can also email us, and we will be happy to sort of coordinate that for you as well. So I thank you for Dr. Searcy for sending those resources to us. And so I'm going to open it up for some more general questions. And